Hello friends, welcome to our YouTube channel, One and Only Pharmacy. So friends, today's lecture we are discuss about pharmacology chapter, drug acting on urinary system, that is diuretics. So friends, I request you to all please watch this video till the end. Let's start with its definitions. What is diuretics? Diuretics, the pharmacological agents which increase the rate and volume of urine formation are known as diuretics. The pharmacological agents which increase the rate and volume of urine formation are known as diuretics. This drug acts on nephron and excretes the excess fluid present in the body. Example of diuretics is mannitol, furosemide, etc. Next point, uses of diuretics. It is used in the treatment of hypertension. It is used in the treatment of poisoning of different substances and drugs, in the treatment of renal failure, in the treatment of diabetes, in the treatment of edema. These are the some uses of diuretic drugs. Next point, classification of diuretics. There are main two classes of diuretics. Four classes: weak diuretics, moderately weak diuretics, very potent diuretics, and potassium sparing diuretics. Let's see one by one with examples. First one, weak diuretics, which are also divided into four subtypes: osmotic diuretics, and osmotic diuretics also divided into two subtypes. A. Electrolytes, example sodium chloride, potassium chloride, etc. are the example of electrolytes. Non-electrolytes, example mannitol, urea. These are the examples of non-electrolytes. Second main subtypes, acidifying salts, example ammonium chloride. Third main subtypes, xanthine derivatives, example theophylline, aminophylline, etc. Fourth subtypes, carbonic anhydrase inhibitors, example acetazolamide. Second main types, moderately weak diuretics, example chlorothiazide, hypochlorothiazide. Uh, Third main types, very potent diuretics, which are also divided into two subtypes. First one, loop diuretics, example furosemide, ethacrynic acid. Second subtypes, mercurial acids, example mercaptomerine. And last main types, potassium sparing diuretics, example spironolactone, triamterene, etc. Let's see one again. Classification of diuretics. There are four main types: weak diuretics, moderately weak diuretics, very potent diuretics, and potassium sparing diuretics. Let's see second main types. Xanthine diuretics. Theophylline is most effective xanthine diuretics, and it is generally used as theophylline ethylene diamine, that is aminophylline. What is xanthine derivatives? Xanthine derivatives acts by increasing the renal blood flow. Xanthine derivatives acts by increasing the renal blood flow due to the both cardiac stimulant property and vasodilator action. They also produce diuresis by inhibiting the tubular reabsorption of water. They are used in the treatment of edema of the heart and kidney associated with renal disturbances. Let's see once again. Theophylline is the most effective xanthine diuretics and is generally used as a theophylline ethylene diamine, that is aminophylline. Xanthine derivatives acts by increasing the renal blood flow due to the both cardiac stimulant property and vasodilator action. They also produce diuresis by inhibiting the tubular reabsorption of water. How? By inhibiting the tubular reabsorption of water. They are used in the treatment of edema of the heart and kidney associated with renal disturbances. Next main types, osmotic diuretics. Mechanism of action of osmotic diuretics. In the proximal tubules of sodium get actively absorbed. In the proximal tubules, sodium get actively absorbed. Along with sodium, there is dragging of water passively in the presence of non-absorbable solute like mannitol. Diffusion of water is reduced relative to that of sodium. Along with sodium, there is dragging of water passively in the presence of non-absorbable solute like mannitol drugs. Diffusion of water is reduced relative to that of sodium. There is an increased urine flow with a relatively smaller increase in the excretion of sodium salts. There is an increased urine flow with a relatively smaller increase in the excretion of sodium salts. The other osmotically active solids like glucose, urea, etc. These are osmotic diuretics. Adverse effects of osmotic diuretics. Which adverse effects of osmotic diuretics, which are as follows: it can cause headache, nausea, chills, polydipsia, Polydipsia means increase in thirst, confusion, pain in the chest. Excessive or rapid diffusion of mannitol causes cellular dehydration and hypokalemia. Next main points: therapeutic uses of osmotic diuretics. Barbiturate poisoning in the treatment of barbiturate poisoning, in the treatment of acute renal failure, in the treatment of cerebral edema. Second main types: carbonic anhydrase inhibitor. Which drugs is a carbonic anhydrase inhibitor? Is acetazolamide. Acetazolamide is one of the drug acts by inhibiting the enzyme carbonic anhydrase. Acetazolamide is one of the drug acts by inhibiting the enzyme carbonic anhydrase. The enzyme carbonic anhydrase is absorbent in the renal cortex. Gastric mucosa, pancreas, CNS, eye, and RBCs. Pharmacological actions of acetazolamide. There are main three actions of acetazolamide: action on kidney and electrolytes, action on eye, action on CNS. Let's see in detail. First, action on kidney and electrolytes. The enzyme carbonic anhydrase plays important role in the tubular reabsorption of sodium and bicarbonate by providing the carbonic acid, which makes available hydrogen ion for exchange with sodium. What is the action on kidney? The enzyme carbonic anhydrase plays an important role in the tubular reabsorption of sodium and bicarbonate by providing carbonic acid, which makes available hydrogen ion for exchange with sodium. Main action on eye. Carbonic anhydrase present in the ocular structure is believed to be important in the production of the aqueous humor, which has bicarbonate content. Acetazolamide reduces the intraocular tension by inhibiting the enzyme. What is the action on eye? Acetazolamide reduces the intraocular tension by inhibiting this enzyme. Acetazolamide action on central nervous system. Acetazolamide decreases the cerebrospinal fluid formation. These are the simple three actions of acetazolamide. ADME means pharmacokinetic of acetazolamide. Acetazolamide on oral administration, get well absorbed. It is not metabolized, but it actively secreted into the urine by the proximal tubular cells through the organic acid pathway. Adverse effects of acetazolamide: metabolic acidosis, hypokalemia, drowsiness, crystalluria, kidney damage, skin rashes, and bloody discresis. These are the adverse effects of acetazolamide drug. Therapeutic uses of acetazolamide. It is used as a diuretics, which means increase the urine flow in the treatment of glaucoma. Antidiuretic drugs. These are the main topic in this chapter. Antidiuretic drugs. Definition: the drugs which decrease urine output by acting on reabsorption of process. That is, they increase the reabsorption of water and sodium are called antidiuretic drugs, are also called as vasopressin. Example of antidiuretic drugs: vasopressin injection, intramuscular, chlorpropamide, desmopressin, lipressin, teleropressin, and carbamazepine. These are the some examples of antidiuretic drugs. Let's see one again definition of antidiuretic drugs. The drug which decrease urine output. The drug which decrease urine output by acting on a reabsorption process. Antidiuretic hormone means ADH. The antidiuretic hormone gets secreted by the posterior lobe of pituitary gland. The antidiuretic hormone gets secreted by the posterior lobe of pituitary gland. It is also known as vasopressin. The state of dehydration stimulates the release of ADH, and a state of hydration inhibits the release of ADH. Action on ADH on different parts of body: on kidney, on CVS, other smooth muscles. On kidney, ADH acts on DCT. Increases the reabsorption of water, which leads to reduction in urine volume. On central cardiovascular system, in large doses, ADH increases the blood pressure by stimulation of the vascular smooth muscles. And action on other smooth muscles: when given large doses, When ADH is given large doses, ADH stimulates the smooth muscles of gastrointestinal tract. ADH stimulates the smooth muscles of gastrointestinal tract, promoting peristalsis. It has very little oxytocic activity. Therapeutic uses of ADH. It is used in the treatment of diabetes insipidus, portal hypertension, and hemophilia. Thank you guys. These are the all chapters of drug acting on urinary system. Let's see one again from start to end. These are very simple chapter to study. Diuretics, definition of diuretics, the pharmacological agents which increase the rate and volume of urine. The pharmacological agents which increase the rate and volume of urine formation are known as diuretics. Example, mannitol, furosemide, etc. Uses of diuretics in the treatment of hypertension, in the treatment of poisoning of different substances and drugs, in the treatment of renal failure, in the treatment of diabetes, in the treatment of edema. Classification of diuretics, there are main four classes: weak diuretics, moderately weak diuretics, very potent diuretics, and potassium sparing diuretics. Xanthine diuretics, theophylline is most effective xanthine diuretics. Xanthine derivative acts by increasing the renal blood flow due to the both cardiac stimulant property and vasodilator action. Mechanism of action of osmotic diuretics. Adverse effects of osmotic diuretics. Therapeutic uses of osmotic diuretics in the treatment of barbiturate poisoning, acute renal failure, cerebral edema. Carbonic anhydrase inhibitor means acetazolamide drug. Acetazolamide is one of the drug acts by inhibiting the enzyme carbonic anhydrase. Sometimes ask the question is which drugs is acts by inhibiting the enzyme carbonic anhydrase. There are many options, but correct answer is acetazolamide. Pharmacological actions of acetazolamide: action on kidney, action on eye, action on CNS. ADME of acetazolamide, adverse effects of acetazolamide. Therapeutic uses of acetazolamide, main use of acetazolamide is as a diuretics. Antidiuretic drugs definition: the drugs which decrease the urine output by acting on reabsorption process. Antidiuretic hormone EDH, action on EDH, therapeutic uses of EDH. सो फ्रेंड्स, ये वीडियो आपको अच्छा लगा हो तो प्लीज़ इस वीडियो को लाइक, शेयर और सब्सक्राइब जरूर करें. थैंक यू फ्रेंड्स.